Switching gears to a topic that you can't help but think about daily, hourly, and that's COVID. I remember sitting with you I guess it was 2 years ago or more now, when COVID was starting to become part of the program that everyone's living with. And we were mapping for the unknown, which was how bad is it going to be? We're a supply chain, black belt supply chain, quality, highly regulated business. We were trying to map the what ifs as it relates to all the different components to the business. You want to talk a little bit about, planning for COVID, and then also, I know as a company we have played a major role with lots of different constituents as it relates to COVID. Can you talk a little bit about what we've done there, and who we're dealing with on a daily, weekly basis on the COVID front?
Yeah, I remember the week everything changed. I was in the UK when the travel ban came in from the president, and scrambling to get back to the United States, not knowing what it really meant, just knowing that probably everything would change forever after that to some degree. And yeah, we spent 2 months more from a standpoint of risk assessment, risk mitigation, making sure that our existing business models could still function, especially where there was a patient involved. And especially with our work in primarily international markets, it was going to be critical that we could maintain our supply chains being open for patients and healthcare providers that depended on us. So a lot of those early days were talking about worst case scenarios, and those are never fun conversations to have. But between us and our partners, we wanted to make sure we were leading the conversation on the risks. After a couple months, and this is maybe not hard to imagine in hindsight, a company like ours that has channels that are sometimes agnostic to the specific product, but just trying to balance the demand and the supply of where drugs are in the world, and make sure those treatments are making sure they're getting to patients. We had a couple of months where our services were in high demand, and our conversation was able to shift from one of sort of existential and risk mitigation and what's going to happen to, okay, our core business is doing fine. How can we help? Right. And if we're in the healthcare industry and we've got a 20-year history nearly at that point of helping patients in low and middle income countries, and in some cases even in the US, Europe, Japan, others, how can we help? And so what we recognize as one of our core competencies is this supply chain that includes high quality standards, regulatory knowledge, and that would include import, export, and then again, a supply chain with flexibility and high control over moving products. Are there products other than pharmaceuticals where we might be able to help? So there was, you may remember at the time, there was high demand for respirators. So we were looking at medical equipment, maybe pushing medical equipment through our supply chain channels, and also diagnostics. And this led to some opportunities where testing quickly became in high demand. Being able to test, trace, and isolate people that were testing positive for COVID was one of the key aspects of trying to fight back in this pandemic and protect ourselves. So we were fortunate enough to be representing some really high quality COVID antigen tests. And this is another good example. Some of the demand was coming to us from low and middle income countries. Some of it was coming from Western Europe, for example, and some of these countries that needed help as well. So again, our ability to be able to distribute into these countries was in high demand, and especially as people were moving quickly, our ability to adapt, be flexible, and be reliable, I think really helped in bridging the testing gap between the amount of tests needed for us to have a successful response versus what was actually available in these countries.
And all the while trying to figure out if people are going to work in their offices, at home. How do you operate in this new environment while trying to solve these issues?
We've got amazing commercially focused, supply chain focused people in our company that are executing on our business model. We've also got an amazing group of people that support our business, that support our commercial teams, that support us through IT, legal, finance, HR, quality regulatory. So these groups really came together, and we've got such a solid foundation that we've been able to build a company upon. Those groups really made it easy for us to be able to make those decisions, to work from home, to be able to execute, to try to be as proactive as we could in a situation where the whole world was just reacting to the pandemic.
And I guess I've heard that some of our folks are on speed dial with various governments as it relates to just trying to continue to work through this because we're not through it yet. You know, how has that sort of come together? And like, you know, that seems to sort of not be a 9 to 5 type job.
Yeah. Yeah. So this is a great example too, where as we've evolved as a company, we've had to establish separate entities in separate markets. Those separate entities use separate licenses in order to be able to perform the functions that we perform. And our goal is to unite all of our different entities and leaders into one point of contact that can seamlessly provide services for folks. This is an example you're mentioning where we have a small group out of our UK entity that is in direct communication with governments about their preparedness, about the testing that we've been talking about. And it's a combination of, at any given time, we're usually fulfilling a current order, working on establishing what the terms are going to be and what the needs are for the next order, and then also looking 1 or 2 steps ahead at what the diagnostic life cycle is looking like and what a more advanced technology might look like, and preparing for either cost reduction or an increase in the capabilities of the tests themselves. So there's a lot of things that are happening at once, and it's being handled by our UK group right now.
And our pharmaceuticals also has the shift of what types of pharmaceuticals that we're selling globally changed at all with COVID?
We have some special programs specifically related to the COVID response, including our clinical services division is assisting with some very rapid deployment of some clinical trials that are around products that could be very helpful. Our managed access program division has also put together programs along with our global access program division to respond to the demand for products that might be very effective in the treatment of COVID. So sometimes it's a commercial program, sometimes it's a clinical services program, and sometimes it might even be a donation program. Separate from the COVID focused programs, thankfully, no, there hasn't been much of an adjustment in the product mix because the demand that was there before, especially for oncology and rare disease drugs, is still there. So part of our, one of our proudest moments related to pandemic response has been our ability to maintain supply chains for critical medicine that we're proud was not disrupted by the pandemic. So we're happy to say that those medicines have continued to make it through the supply chain and get to the patients the way they need to.